Okay, good morning. It is Tuesday, March 19th. First day of spring, that's the happiness, and to waking up to a lot of snow, but it's still spring. Senate Health and Welfare Committee. So we have a limited time today, so I thought it might be useful to highlight some of the issues that we probably should take up. One of them is the discussion of the Office of Health Equity that came to us by way of letter that we brought up last week. And it's tentatively was on the calendar for today, but I thought we might just postpone that until we can have some folks in and have a full discussion. We can talk about it if you'd like. And then we have a slew of bills coming in. And the ones that we have in on the social work compact, on the occupational therapy compact, on the peer support provider and recovery support specialist certification, it was actually that we started a few years ago, we'll have that. And then the harm reduction criminal justice response to drug use. Those are the bills that we currently have that we'll take up. And then there are bills on the calendar in the House, or 4 or 5 bills on the calendar in the House that will also take up. You need somebody.
I just have a question and I don't want to mess it up. We did, and I think it's.
Okay, we're live. Would you like us to go off live?
No.
Okay,
So we did 197 yesterday or last week or probably,
yes,
and the change in title is a little different. I just wanted to make sure that what was printed was what you wanted.
Okay.
Because I can't read it. Are you good at reading it?
Yeah, I do.
I'm gonna screw up one of the P words. So, because there's an end of.
PFAS.
Yeah, there's an end of, and I didn't know if I should just have an end or an end of, and I wanted to make sure the title was right. This is part right here. Because we're about to send it to the House. It wasn't that way in the calendar.
Restricting perfluoroalkyl and polyfluoroalkyl substances, that's right.
No, but it says, it says end of. You read it when I think the of should be deleted, but it was in the report we received, it was in the calendar.
No, an act relating to restricting PFAS and, they're two different substances.
So do you want end of, or do you want just, okay,
Yeah.
Can I just look at it? I think I know it's right.
I think it is.
I just wanna make sure, because I'm sorry.
We just looked at.
We like to see you, happy to see you.
If you want me to come down?
I told you, I think here's the problem.
Yeah.
I think the problem is that may have been restriction, and now it's restricting. So the of doesn't fit with restricting.
I will do whatever
So,
you tell me to do.
okay, committee, listen to this. Okay, an act relating to restricting perfluoroalkyl and perfluoroalkyl substances in consumer products.
Yeah, get rid of the.
So if we take out the of, it's an act relating to restricting perfluoroalkyl and perfluoroalkyl substances in consumer products.
Yeah. Good
What do
catch.
you think?
Amazing.
Take the rest of the day off.
Yeah.
That's how we done it.
I never catch anything. My staff does everything. I'm just a fix guy. I am just one of those, whatever they call them. I'm not really here. I'm a bunch of lights, whatever
I
they.
waited for the LG
A
to take the
sprite,
gavel.
you're a woodland sprite.
Oh, that's better. I like
That's so
that.
good.
That's what I always say.
That's what we say about people. And,
You do not way too mean with this.
That's true, that's true.
Thank you. Okay, well, that's settled. We did something. Okay, so we've got those bills on the calendar, just because we're gonna have a lot of House bills and some of them are gonna be long and difficult. I'm thinking that the compact bills won't be as challenging perhaps, except for the money that the Secretary of State needs. So we're gonna do those first. We may not do appointments tomorrow because Jen is able to come in tomorrow morning on S18 and we can look at the differences between House and Senate. My initial read through, it's just initial and no, thinking about what's happened there, it was not overly significant, but we can make up our minds.
Hold on.
Yep. So if you think differently, let me know. We have three choices on S18. Concur with further proposal of amendment. Or ask for a conference committee,
Or what?
a conference committee. But it doesn't look like we're going to need, either concur with further proposal or conference committee. I'm thinking probably doesn't make any sense. Especially given all the attention Bill's received. So that's that. So we also then will have the Office of Health Equity, and then, Senator Weeks and Senator Williams were interested in the, CON for, in visiting.
I said, actually, I talked to him, and he said, if you want to touch five, I gave him Keith's.
Right, good.
COS.
Certificate of need, at the, pre-med care board. So if it's a certificate, right now, well, we can have ledge council present it to us, but there are a set number of visiting nurse associations that include a variety of services that are distributed across the state. So there's geographic sort of areas that each business covers, and then there's one statewide business, BIATA. The having more, and the VNAs of the state are challenged financially. So if competition comes in and an organization takes off only those that can pay, then it becomes difficult for the smaller, not smaller, but the companies that accept Medicaid patients. So we'll have to look at that, and I do know that in the budget adjustment, the CON was extended, but we want to talk about that in here. So that's another issue that you have brought up, and we should look at that. Then we also have appointments. Is there anything else of an outstanding nature? I think at this point. So tomorrow morning, S18 will be front and center. What time is it?
Be on here at 10:30
S18.
for,
Got it out at 10:30. Yeah, about Jen's here. We can do it before. Okay. So,
Why are you leaving at 10:30?
I have to, brief S25 to, Human Services
Oh, okay,
Committee of the House, yeah.
gotcha.
so
They asked me for that.
I think it's nice that they ask,
Yeah.
you know, I always ask House members to come down.
And I've already, I already briefed them last year.
Yeah, well, we need a refresher course.
Yeah.
What else is there up there that we have? I think I've got all the H bills down at this point. H72 is the bill that came over earlier in the year on overdose prevention sites. That's it.
Chair Lyons. It looks, I'm looking at S18, it seems as though, Jill might know this, that the menthol ban has been turned into a study with a report.
Oh, we'll look at that.
Okay. Okay.
Okay. All right, so if that's the case, it might be a longer process. In the final. Anything else? The other thing is, I'd like to have an update, if we can get some time, have an update on how the childcare implementation is going. And then there are a couple reports we may want to look at coming forward. Other than that,
Yeah, and the other one was did we get something back on the school lunch program? Or was that education?
No,
Education.
education,
They basically said that there was a lot of participation. Yeah. I think that's what they said.
Okay, anything else? We're good? So I think we're just gonna call it a day and we'll come back tomorrow. Need a little time off. And if you see bills that are coming over to us from the House that you think are critical that we look at or that we have in committee, let me know. I'm doing that.